For many parents, leaving the hospital with a healthy newborn is a joyous moment. However, for others, childbirth is faced with challenges. Farida Nakayenze, who was pregnant with twins, began experiencing labor pains at 7 months and 2 weeks. Doctors told her she had to deliver early as she could not carry the babies to term. Despite the concerns, Nakayenze successfully gave birth to a baby boy and a girl, though both were underweight. She feared they would not survive.
My son was 900 grams, and my daughter was only 1 kg. But they were in the bad condition. They were like rats, or they were like lizards. So I was too scared, and I was like, how am I going to raise these kids?
Nakayenze's survival and that of her children was partly possible because of the ability to rush her to the hospital on time. However, many women in the West Nile sub-region do not have this chance, often facing delays due to lack of transportation to the hospital or money. These delays are a contributor to the maternal mortality rate in the region.
We receive from government and various partners who are providing ambulances, but most of them evacuate patients from health centers, health center 3 and so on, to the referral points where they are able to be helped with either operations or some other treatment. But from the community to the hospitals is still a challenge. Most people struggle a lot. They look for motorcycles when they are not supposed even to sit on motorcycle. Others even get accidents on those motorcycles because of the various terrains. So that is areas which we need to work on.
While the maternal mortality ratio remains high, there has been a reduction. The hospital partly attributes this to the refurbishment of high dependence units and also capacity building of health workers to monitor mothers with complications more effectively.
For our part here in Arua Regional Referral Hospital, we have been supported heavily by the UNICEF through CEDA project in training on how to care for those critical mothers, how to give emergency obstetric care.
I'm seeing more and more institutions having less maternal deaths compared to the past. Of course, the overall picture in the community may be different if we look at the community data. The government of Uganda is very keen this, the health workers.
The hospital has also seen a high number of C-sections, with about 200 performed each month out of 600 deliveries. Many of these are attributed to teenage pregnancies, as young girls often lack the physical maturity to carry a pregnancy to term. The hospital, as a regional referral facility, also receives mothers in critical condition from across the area.
The mother herself is not yet ready to carry deliveries. Her body is not yet well developed to carry normal deliveries. The teenage pregnancy is very high in this part of the world. It's over 20% of those mothers who go to the antenatal. So those ones, most of them end up being done cesarean section. So it makes the cesarean rate to go very high.
Health experts note that C-sections are not performed for monetary gain, as it is sometimes necessary to save the lives of both the mother and the child.
So people should not think that no woman should have cesarean section. There will be always a percentage. For example, if the baby is coming across, definitely will not pass. So they should not blame the woman. If you want to get the baby alive, you have to do cesarean section.
Nobat Atkunda, NTV Tonight.